certainly lots of things improve with weight loss in general. High blood pressure, many people, 70–80% of people with sleep apnea will even be able to get rid of that sleep apnea machine and not have to use that at night. Diabetes improvement, this is the one that we really feel is a very important part of bariatric surgery in general. All procedures are really very effective at doing this. Everything works in different ways. Gastric bypass works basically in a way that deals with the hormones specifically. Hormonal changes happen in the duodenum, which is where the first portion of the small intestine is, where we bypass, where food doesn't go through, and the pancreas is where all the insulin sits in your body. Well, some surgeons said, well, you know what, I'm not sure how they did this, but they genetically engineered rats to have type 2 diabetes and basically said, well, let's go ahead and bypass them. Let's do a modified bypass. Let's just have the stomach disconnect here and just connect it further down so we bypass this portion where all the insulin control is. And lo and behold, in those genetically engineered rats, the type 2 diabetes resolved. I said, well, that doesn't make much sense. Well, then they put them back together, checked these same rats, and found out that the diabetes came back. So clearly something was happening in this portion of the duodenum that was causing their diabetes to resolve almost instantaneously. And in fact, we see that also with our human surgical literature, that the diabetes improvement is 85% or more in many people. Almost within days, we have people off of their diabetic medications, especially if they're only on oral pills. Depending on how long you've been on insulin, sometimes we can get you off of insulin. If you've been on insulin for a very long time, 10, 15 years, it might be a little different. If you've only been on it for a few years, sometimes you can actually resolve it where you're not even doing insulin anymore. But in Brazil right now, they are doing that because they're doing these modified bypasses in people who even have body mass indices of 28, 27, where you don't have the red tape or the things, steps and hoops that you have to do here in the U.S. And we're very interested to see what our colleagues down in Brazil are going to find out as far as we really do feel that we may have a surgical cure for diabetes, at least for many people, okay? This study by Dr. Pori, one of our founding fathers, was back in 1995, and multiple studies again have recreated the same data, but it's basically comparing conservative treatment or non-surgical weight loss with the dotted line to surgical weight loss, which is patients who are in the solid line. And you can see in the first year, sure, both of them work aggressively hard at losing weight and watching your diet and lifestyle changes. Yes, you can see that both lose weight and their body mass indices came down. However, over the long term, which one had the better tool ultimately to give them the long-term sustained weight loss? And that was people who had had surgery. And these patients were people who had had gastric bypass, okay? So you can see at 6 years out, their body mass index had dropped from almost around 50 down to 30, and they were maintaining it.